Good day everyone, we are the group 2 and our report is about ADHD or Attention Deficit Hyperactivity Disorder. ADHD is one of the most common mental disorders affecting children. Symptoms of ADHD includes inattention or not being able to keep focus, hyperactivity or excessive movements that is not fitting to the setting, and impulsivity or hasty acts that occurs in the movement without being thought or um, deciding right away. ADHD is considered a chronic and debilitating disorder and is known to impact the individual in many aspects of their lives, including academic, professional achievements, interpersonal relationships, and daily functions. ADHD also can lead to poor self-esteem and social functions in children when not appropriately treated. Adults with ADHD may experience poor self-worth, sensitivity towards criticism, and increased self-criticism, possibly stemming from higher levels of criticism throughout life. Also, ADHD can be diagnosed at any age. This disorder begins in childhood. When considering the diagnosis, the symptoms must be present before the individual is 12 years old and must have caused difficulties in more than one setting. For instance, the symptom cannot only occur at home. It can also occur at school or maybe when playing with other kids.
Okay, let's move on to the three main types of ADHD, okay, which are the predominantly inattentive presentation, and second is predominantly hyperactive or implosive presentation, and lastly is the combined presentation. Okay, let's talk about the first main types of ADHD, which is the predominantly inattentive presentation. Inattentive refers to challenge with staying on task, focusing, and organization. For a diagnosis of this type of ADHD, 6 or 5 for individuals who are 17 years old or older. Okay. Predominantly inattentive presentation, okay, is the children with this presentation have inattentive ADHD only. Okay. Providers previously called this type of attention deficit disorder or ADD. Okay. Children with inattentive presentation is mainly have a difficulty in focusing and organizing and staying on track, and also have fewer hyperactivity or impulsivity symptoms. Okay. Person who are hyperactive often behave impulsively, and they may also have a short attention span and be easily distracted. Okay, let's talk about the second main types of ADHD, which is the predominantly hyperactive or implosive presentation. Okay. Hyperactivity refers to excessive movement, such as getting excessive energy, not sitting still, and being talkative. Okay. Impulsivity refers to decisions of or actions taken with thinking through the consequences. For a diagnosis of this type of ADHD, okay, 6 or 5 for individuals who are 17 years old older. Okay. Okay. Children with this presentation shows issue with hyperactivity and impulsivity, and may show less obvious trouble with paying attention. Okay. And hyperactivity means they have, okay, as I said earlier, they may fidget, can sit still, and have a lot of excessive energy and extremely talkative. Okay. Impulsivity means they may interrupt others and act without thinking it through. Okay. First, this is the least common type and typically affects younger children. And the last main type of ADHD is the combined presentation. Okay. Combined, okay, this type of ADHD is diagnosed when both criteria for both inattentive and hyperactive or impulse type are met. Okay. Combined presentation. Okay. The children with this presentation show at least six symptoms from both of the other types. Okay. Symptoms of inattentiveness and hyperactivity. Okay. Impulsivity presentation. Okay. Is equal. Okay. This type is what what people most commonly associate with ADHD, is about 70% of cases fall under this type.
Good day, ma'am. I am Angeline Fadute. I am the one who discussed the ADHD sign and symptoms in children. It is normal for children to have a trouble focusing and behaving at one time or another. However, children with ADHD do not just grow out of these behaviors. So the symptoms can be severe and can cause difficulty at school, at home, or with friends. So these are signs and symptoms of ADHD. First is forgetfulness. So lost things, forget or lost things a lot. Second is carelessness, make careless mistakes or take unnecessary risk. Um, Third is risky behavior, have a hard time resisting temptation. Fourth is trouble getting along, so difficulty getting along with others. Some Fifth is disorganization. Six, excessive talking or talk too much. Eight, seven is daydream a lot, and the last is difficulties sitting still. There are also ADHD symptoms, signs and symptoms of adults. So these are difficulty at work, at home, or with relationships. So in these signs and symptoms, it is important to note that these symptoms should be persistent, pervasive, and is exhibiting these signs. It's important to seek a professional evaluation for a proper diagnosis and a treatment plan. In diagnosis in ADHD, deciding if a child has ADHD is a process with several steps. No? So there is no single test to diagnose ADHD. So one step of the process involves having a medical exam, including hearing and visual tests, to rule out other problems with symptoms like ADHD. Diagnosing ADHD usually includes a checklist for rating ADHD symptoms and taking a history of a child from parents, teachers, and sometimes the child. So let's move on to causes of ADHD. So scientists have not yet identified a specific causes of ADHD, while there is growing evidence that genetics contribute to ADHD and several genes have been linked to disorder. No specific gene or gene combination has been identified as the cause of disorder. However, It is important to note that relatives of individuals with ADHD are often also affected. No? So this means that the causes and risk factors for ADHD are unknown, but current research shows that genetics plays an important role. So the genetic will be um, it will not just sa mga genetic ang magkaliwat na juting ang kani nga sakit kaning disability nga ADHD. So there are a related condition of ADHD. No? So first is autism spectrum disorder. Second is disruptive impulse control and conduct disorders. Social communication disorder. Specific learning disorder. So how to manage these symptoms now? So in these symptoms we need to manage this. No? So the only way is to manage these symptoms of ADHD is staying healthy. So being healthy is important for all children and can be especially important for children with ADHD. In addition to, behavioral therapy and medication, having a healthy lifestyle can make it easier for your child to deal with ADHD symptoms. So, healthy behaviors that may help are first is developing healthy eating habits, such as eating plenty fruits, vegetables, whole grains, and choosing lean and protein. Um, Resources. Second is participating in daily physical activity based on age. So, dapat i-engage sila sa mga physical activity. And third is limiting the amount of daily screen time from TVs, computers, phones, and other electronics. So the last is getting the recommended amount of sleep, no? Each night based on age though. So these are the how to manage the symptoms of ADHD.
Okay, let's move on to ADHD treatment. It is usually encompasses a combination of therapy and medication intervention in preschool age and younger children. Okay. The recommended first line approach includes behavioral strategies in the form of parent management training and school intervention. Parent child interaction or therapy or PCIT is an evidence based therapy modality help young children with ADHD and oppositional defiant disorder. Okay. Okay. According to current guidelines, psychostimulants or amphetamines and methylphenidate are first-line pharmacological treatments for management of ADHD. Okay. How ADHD treated? The goal of ADHD treatment is to improve your child's symptoms so they can function function more effectively at, at home and school. Okay. For younger children, age 4 and 5, okay, the providers recommend intervention for parents as the first line of treatment before medication is tried. Okay. In most cases, the best ADHD treatment for older children or adolescents and adults includes a combination of behavioral therapy and ADHD medication. And that's all about the ADHD treatment. And let's move on to the next next topic will be tackled by Miss Kari Antonio.
Parenting strategies. Raising a child with ADHD can be stressful because society does not accommodate ADHD. Parents often have to put in more effort to get school accommodations for their children. Parenting a child with a different neurotype can also create stress when parents don't have the enough information they need about how to best support their children because these type of children often requires constant supervision and more structures than other children. Here are a few behavior modification strategies that are often taught in parent support program. First is positive attention or provide positive attention. Positive attention helps parents create healthier relationship with kids and a stronger bond means that the kids are more likely to respond to praise. Second is give effective instructions. Gain your child's full attention before giving directions. Kay, di ba this kanang type of children's kanang kuan maglisod sila og keep silang focus. This can look different for each kid. Ask them what helps them focus and follow directions and accommodate their neurotype. Some examples are includes writing down detailed instruction, showing them how to do the task, body doubling, and flexible scheduling. Third is the praise your child's effort. Catch your child being good and point it out. Praise can promote secure attachment with with your child and frequent and specific feedback is important. Like, wow, you do great. Nga bitaw. And then next is the established reward. Reward system can be a great way to help kids with ADHD stay on track. Establish a few target behaviors such as staying at the table during a meal or using gentle touches with a pad. ADHD does not need to be cured or fixed. Instead, it is important that it is accommodated and supported. If parents and children have enough affirming and accepting information about ADHD, they can work together for the child to thrive. We will end our report with this lovely quote: "You're not alone, and there's nothing wrong with you." Thank you.